Everybody, my name is Bianca Gonzalez, and I am the Bullying Prevention Program Coordinator with the Riverside Medical Clinic Charitable Foundation. Welcome to our monthly endometriosis support group webinars. If you're new to our webinars, they are held on a monthly basis. And just in case you may need to leave in the middle of the webinar, we do record these, so you will be sent a replay afterwards. And then we also have our YouTube page where we upload all of our webinars on there as well. And we have all of our previous webinars on there just in case you want to view all of those too. So I also want to add in to follow all of our social media accounts. We do have a Facebook page and an Instagram as well. So our Facebook is at Endometriosis Family Support Group, and our Instagram is at Endo Family Support Group. So please feel free to follow and like all our posts. If you have any questions or comments, we do have a chat box on the right-hand side. And then we also have the option of providing any questions towards the bottom of the screen as well. So don't worry, we're going to have a Q&A session after the presentation, and any of your comments and questions will be answered during the Q&A. So I would like to now introduce our speaker for today, Dr. Leslie Wakefield. Dr. Leslie Wakefield is a doctor of physical therapy with a holistic boutique practice in Hollywood, Florida. Her practice is focused upon pelvic rehabilitation and women's health, and she has a particular passion for working with patients with scar tissue and chronic pain. Her training includes a master's degree in human performance from the University of Florida, Doctorate of Physical Therapy from University of Miami, Miller School of Medicine, as well as Polestar Pilates instructor training, Barnes Myofascial Release, Visceral Manipulation, and pelvic floor therapy. She's also a certified strength and conditioning specialist with the National Strength and Conditioning Association. I will go ahead and give it away to her.
Am I on?
You're on.
Great. Thank you so much. I'm honored to be here, and I really appreciate you having me. This is one of my favorite things to talk about. I'm used to being one-on-one with my patients. I was telling Bianca before we got started. I'm not used to not being able to see people's reactions, so I'm just going to imagine that I'm talking one-on-one. And I'm going to try and give you a lot of the information that I would give to a patient who is coming into physical therapy for the first time. The topic is, what can physical therapy contribute to the care of patients
I'm sorry,
with endometriosis?
do you mind if you can just turn up your volume a little bit so we can hear you a little bit louder? Thank you so much.
Yeah, I'll move on. I did put together an outline for myself, but I do tend to ramble a little bit when I'm talking to patients. I have some soapboxes. So I will try to stay on topic and loop back around. And if I miss anything, please just ask me for the questions when we get to them. So I think the first question to address is, what is pelvic PT? This is a physical therapist that specializes in pelvic health concerns. Most of us think of physical therapy as something maybe a little bit more orthopedic, maybe ankle sprains or lower back pain. But there are physical therapists that specialize in working with issues of the pelvis. And that doesn't mean we only treat the pelvis, because the body is completely connected. We have to treat the whole body. But we may focus on issues specific to pelvic health. And this is actually a huge area. You can imagine the spectrum of issues that would span women's and men's and trans-specific health concerns, pediatrics, pregnancy, postpartum, menopause, bladder and bowel, sexual function, chronic pain. There are many areas that a PT can have an impact on. And it makes sense when you think about how complex the pelvis is and how integral it is to our day-to-day lives. The pelvis has muscles and ligaments and joints and nerves and connective tissue and lymphatics, just like anywhere else in the body. And just like anywhere else in the body, these can be injured and they can have pain. Then on top of that, it contains organs. It supports those organs against gravity 24/7. It coordinates with breathing. It contributes to absolutely primal bodily functions like bladder and bowel control and sexual function. And on top of that, we have the influence of hormones. So there's a lot going on in that area, which means there's a lot of places that pelvic PT can help. And that brings us to the topic today, which is, what can physical therapy do for a patient with endometriosis as a part of a interdisciplinary approach? And the first thing to say is that PT cannot treat endometriosis itself. And now the room goes crazy and like, why are we even listening to this? But I think it's important to differentiate, because what PT can do is treat the sequelae that arise as a result of endo. So people with endometriosis deal with a constellation of symptoms that arise as a result of endometriosis. These symptoms are a result of the chronic pain and chronic inflammation that comes with endo. And often people don't realize that there's a difference. I mean, how could you even know? So for example, one really common symptom is pain with sex. How are you, as a person with pain during sex, to know? You say, I have pain with sex, I have endometriosis, so I have pain with sex. But how are you to know whether that pain is because of an endo lesion that's sensitive and painful? Or is it because of adhesions that have built up because of the inflammation of the lesion over time? Or is it because of scar tissue from a surgery to address that lesion? Or is it because of muscle spasm that's developed over time because of the chronic pain and tension in that area? And then if you're the patient with the symptom, how are you first to know which one it is, and then even that it can be treated, and in many cases completely resolved. So this is where physical therapy can come in to help. And that is really what I'd like to talk about, which is what is it about endometriosis that causes these issues, and how can they be treated? So every patient is different because everyone's endo is different. But what might this look like? If you're going to physical therapy, what are you coming for? You could have chronic abdominal or pelvic pain. You could have digestive issues. You could have difficulties or pain with bowel movements or problems with urination. There could be sexual pain. There could even be like nervous system over-arousal. And that can present in a lot of ways, but in general, everything becomes more sensitive. There could be issues with breathing or rib pain if the diaphragm is involved, or if there's endo outside of the abdominal cavity. Every patient is completely different. So this could look like a lot of different things. What is it that can cause pain for a patient with endo if it's not endo? And I'm going to talk about three things today. I'm certain that there's more, but these are three big things that a physical therapist is going to look at for you, or look for you, to see if they're causing pain as part of your constellation of symptoms. And that would be muscle spasms or trigger points, fascial restrictions, which includes adhesions or scar tissue, and these can put pressure or restrict pain-sensitive structures like organs and nerves and muscles and joints. Or is there nerve irritation? And these are the three things we're going to talk about today. So how does this happen? What is it about endometriosis that can result in spasm, restriction, or nerve irritation? And it does come down to your body being brilliant. And I tell this to patients all the time, and they look at me with absolute disbelief, because usually it doesn't feel that way. It feels like you're at war with your body. It feels like every day is a battle. But when it comes to muscle spasm, fascial restrictions that your body are producing, it's really just your body trying to protect itself from pain and trying to heal the inflammation. And then these other things start to develop as a result of that process. Patients coming to physical therapy with endo have had many years of chronic inflammation, chronic pain, and potentially multiple surgeries. So that turns into many years of the body trying to protect, trying to heal. And as a result of this, these secondary symptoms occur. We'll start with chronic inflammation. What happens? What happens when there's a chronic inflammation in the body? This is actually your body being brilliant. It is always trying to heal. And I like to use the example of like a little paper cut. If you cut yourself before you go to sleep, you will wake up in the morning and it will be completely healed. And you didn't have to think about it at all. Your body initiated an automatic process of healing with, and inflammation was an integral part of that process. It's the body's natural first step in trying to heal what it perceives to be an injury. So let's use the example of the paper cut. You cut yourself, little chemical messengers get sent out, and it causes inflammation at the site of the cut. And that inflammation draws in the repair crew. It's the signal to bring in repairs. The main repair crew is called collagen, and we've all heard of this because we want it to be nice and tight and lifted. It's something that gives structure to our tissue, and it's a main component of all connective tissue in the entire body. It's a building block. So when your body perceives damage, what does it do? It's going to throw in the building blocks to try and reinforce that area, hold it together. When you scar, it's really just your body trying to reinforce an area that needs repair, and collagen is the way it does that. So the example of a paper cut is like an initial inflammation and initial healing. What happens when that becomes chronic? So what would happen if you continually got a paper cut in the same place to this every day, day after day? Over time, that area would become thickened, it would become scarred, it would become more restricted. The tissue wouldn't be the same extensibility and fluidity that it was originally, because it's a chronic state of trying to heal, trying to heal, trying to heal, kind of layers upon layers of these little tiny scars coming together. And it's just a result of a chronic state of healing. It's just a thickened area of what would otherwise be normal connective tissue. And when it's inside the body, we call that adhesions. And these can potentially, depending on the location, they can cause irritation to the delicate structures that they're within and around, and they can limit mobility. So things that maybe should be sliding and gliding now are a little bit more restricted. Since we're talking about adhesions, and you might be wondering about post-surgical adhesions because we hear that a lot, something similar does happen with surgery, but surgery is an acute inflammation, not a chronic. It's an acute healing process. You may have had surgery for removal of endometriosis. Many patients have had multiple surgeries. And although it is intended to remove the source of the disease, it does require a healing process from your body. So as the body heals, it goes through the same process of inflammation and reinforcement, and scar tissue develops. And we want this. This is what keeps the incisions closed. We want to be healed. You can see it from the outside as little tiny scars, and you can imagine that inside it extends internally to anything that was surgically addressed. So, and this is natural and normal and good so that your body can heal. And so a patient with endometriosis may have adhesions that result from either chronic inflammation or from surgery. And this could cause absolutely no problem whatsoever. This could be perfectly fine. It's a natural process. You could be completely symptom-free. However, if these fascial restrictions, fascia is the connective tissue, so if these connective tissue restrictions are in a sensitive area, or they're pressing on a pain-sensitive structure, or they're restricting a nerve, they can cause pain or other symptoms. And we associate this pain with endo. It's a result of endo, but it's not the same thing as the endo itself, and it can potentially be treated. A secondary effect of inflammation is that it's an irritant to the structures around it. It means a chemical irritant. And that's going to lead me right into a discussion on the effects of chronic pain. But just to say that when you have a chronic irritation to a muscle or a nerve or connective tissue, it causes a reaction from those tissues, and that reaction can cause its own secondary pain, like a muscle spasm. So when we're talking about what can be treated with physical therapy, we just went over fascial restrictions, adhesions, limitations in mobility within the tissues that result from chronic inflammation. We also have muscle spasms and trigger points and nerve sensitivity. So let's talk about just the pure chronic pain associated with endo and how that can cause its own set of symptoms, a secondary set of symptoms that then can be treated by physical therapy. Patients that come in for physical therapy have unfortunately spent countless hours in pain, drawn in, clutching, holding. We try and literally like cradle ourselves to protect these areas of pain, and it's instinctive. A lot of times we don't even realize we do it. We don't even realize that we're tense all the time because of pain. And people with chronic pain hold this tension in their bodies just from the effort of dealing with the pain. It's an instinctive response to pain. And I like to use the example of, like, let's say you get hit on the arm. Somebody comes and punches you on the arm. What do? You grab it, you cradle it, you draw it in, We rub it, we protect it, we stop moving it, we clutch it. Okay, so that's pain. So now let's apply the same analogy. We talked about inflammation, chronic inflammation. What about pain, chronic pain? So if getting punched on the arm is pain, what happens when someone is punching you over and over and over again? Every day, on the hour, every hour, this is chronic pain. And you know they're coming, and you know it's going to be in the same spot, and your muscles, not even just your mind, but your muscles will start to anticipate the pain. You're going to be instinctively tensing against it all the time. And that area is going to get more and more sensitive. Over time, your arm, you would develop shortened, tight muscles. These muscles would easily go into spasm. They'd have knots in them. We call those trigger points. And now your arm doesn't hurt just when someone's punching it, but it hurts all the time. Maybe the muscles around it start to hurt because they're clinching with it. And so you start to see how chronic pain, they have a one punch or the multiple punch, that can lead to muscle tension. It can lead to spasms, trigger points. And these muscular issues cause pain. And while they're not, and because they're not the endo itself, it can be treated. It's a result of endometriosis, but it's not endometriosis, if that makes sense. So for patients with endo, the common muscles that this happens in is the abdominals, the pelvic floor, which is the space between your sit bones. It's the muscles that control your bladder and your bowel, the inner thighs and the hips. And all of these muscle groups can refer pain to other areas. When we say refer pain, it means the muscle that spasms actually causes pain in another location because of the way the nerves work. So each of these muscles has its own unique pain pattern. Just like a tight neck would cause a headache, and we just kind of consider that normal. Oh, my neck is so tight and now my head is hurting. The muscles of the pelvis and the abdomen and the hips, they also refer pain to other places. And you can just imagine how that might contribute to chronic pain if those muscles are constantly clenched and tensing. So now, not only is your body dealing with the pain from endometriosis, the chronic pain of endometriosis, but now it's also dealing with a secondary pain caused by over-tight muscles. And this is something that can be treated with physical therapy. Tangent. So coming back to my outline, we're talking about pain generators, and these can be treated with physical therapy. We talked about soft tissue restrictions, fascial restrictions like adhesions and scar tissue. And we just talked about muscle spasm. The last one I mentioned, although there are certainly more, I'm sure there's more, but I think these are the main ones, would be nerve sensitivity. Nerves can be, we've talked about this, they can be irritated by mechanical factors, like adhesions that we discussed. They can contribute to pain caused by muscles by referring the pain to other places. But even, and so that's kind of a local nerve issue. But even beyond that, the nervous system as a whole can become tuned in to pain, like a radio station, tuning into it. And it can become amped up, like the volume on the radio gets turned up because of pain. Pain stimulates our fight or flight. This is a systemic physiologic response. And I say physiologic because it's not just like we get nervous and we think about fighting or running. Your blood pressure changes, your hormones change, the distribution of blood through your body changes. This is a nervous system over-arousal or arousal that changes everything about the way our body functions. And pain will stimulate this fight or flight. It's just like I said in the beginning, your body is brilliant. It is doing its best to protect you and heal you. So when it perceives the threat of pain, it's going to go into this fight or flight response to try and save you. I mean, it's just like you're running away from a lion. Your body wants to save you. It's going to go into this amped up mode. Except the pain with endometriosis often doesn't end. So that means your fight or flight becomes chronic. And we're talking about chronic issues, chronic inflammation, chronic pain. Chronic pain can cause a chronically over-aroused nervous system. And that means you're over-aroused, you're hypersensitive. And it's not just to pain. People might have trouble sleeping, trouble concentrating. You might feel fatigued all the time. I mean, literally your body's running on fumes all the time. Stimuli that shouldn't be bothersome might be. And we basically, our entire system, you think I'm fried, like I feel fried. Our entire nervous system can be completely over-aroused because of a response to chronic pain. And the second component of this sort of systemic response, and it's really cool what the nervous system can do, it can tune in or tune out things. We live this all the time. You know, I'm not really noticing the clothes that have been touching my body all day long. If I noticed it, I would go absolutely crazy. I wouldn't be able to think about anything else. Our brain, our nervous system tunes this out so that I can give attention to what's important. It can also tune in then to what it does perceive as important. And the more we're aware of something, the more important our nervous system perceives it, so the more it tunes into that. We become more aware of pain, and it's almost like it's turning up the volume so you can't turn it down. And now we have this really lousy combination of hyper alert because of our fight or flight, and our awareness, our sensation, not just of pain, but just sensation in general, could potentially be amplified because of the way our central nervous system works. It's a brilliant response, but unfortunately, when it's dealing with this chronic issue, we call it maladaptive. It's no longer working for your benefit. So you put all these things together. You have endometriosis. Now you may have fascial restrictions or adhesions or scar tissue. They could be restricting pain-sensitive nerves and organs. Maybe you have muscle spasms and radiating pain because of the tension, and your nerves are completely overstimulated. And all of these sensations are mixed together, and I mean, you can't tell them apart, you just know what you feel. It's impossible to relax, and the cycle perpetuates. More clenching, more pain, more restriction, and it just cycles and cycles. And you know, even when I say it, it sounds terrible, and it sounds doomsday, but I really think that it's important to describe it, to name it, and say it openly, because it's real. It's a physiologic process that's happening in the body. And when it's in your body, you feel like a crazy person. You know, all these different things, and none of them make sense, and it's hard to explain, and maybe I'm afraid nobody's going to believe me, or they don't understand what I'm describing. But this is not just in your head. These things that I described are a result of your body trying to compensate, trying to heal, trying to do its best. But they're physiologic processes happening in your body. And the good news is they can absolutely be treated. So brings me back to my main point. While physical therapy cannot treat endometriosis itself, it can treat so many contributing factors that go into the pain that we associate with endometriosis and that develops over years of dealing with that. I'd like to talk a little about what would happen if you went to PT. What we just did is kind of go over the what and why of how PT can be useful. But what does that translate to in terms of you going to see a practitioner? Like, how do we address those things? Going to pelvic PT is not the same as going to a regular physical therapist. When you go for something like endometriosis or other women's health concerns, you're most likely to be one-on-one with your therapist. In my office, sometimes there's 2 therapists with 1 patient, depending on what you need. There's much more one-on-one time spent with the person treating you. You're usually going to be in a private treatment room, and it's often for an hour, easily for an hour. Because we're working on areas of the body that are very sensitive and potentially intimate, and you definitely need that privacy and that one-on-one time. So we will use manual therapy, which is techniques with our hands. It may include massage, but it's generally not massage. Joint mobilizations and trigger point release and fascial manipulations. So we use manual therapy to release the tight muscles and to give mobility to tissues that might be restricted. And these treatments might be external or internal. Internal work is work done on the pelvic floor, and that can be done vaginally or rectally. And I know that sounds really invasive. It's a little bit like going to the gynecologist. And a lot of people have anxiety about that because there's already a lot of pain in that area. But it's a really direct way to be able to access muscles and structures that can be directly contributing to your pain. So a pelvic PT is trained in this. We're super sensitive, really gentle, really careful. And we would always, only do something that you, the patient, were comfortable with. We can also use exercise. And what's interesting about this type of exercise is a lot of times it focuses on relaxing the muscles rather than tensing. We think of exercise as like lift and push and pull. But for patients dealing with this chronic inflammation, chronic pain, and nervous system over-arousal that we've been talking about, a lot of times the most beneficial exercise is actually learning to release that clinch. You're still training your muscles, but you're training them in a completely different way. We use something called biofeedback, which is, it's just a way of giving you a visual representation of what your body is doing. It's often used for the pelvic floor muscles. As I mentioned before, these are muscles that are between your sit bones. They control your bladder and your bowel. They're often really implicated in pelvic health concerns and chronic pelvic pain. And what it would be either little sensors on the outside or even a little sensor inside that picks up the electrical activity of the muscle, and it transmits this to like a visual so that you can see what your muscles are doing in any given moment. A lot of times we have really no connection, no understanding of what's happening down there. And if you tell someone to like contract or relax your pelvic floor, you might as well be telling them to digest faster or digest slower. Like, it makes no sense. What are you talking about? So biofeedback can be a really useful way of letting you see what your body is doing and helping you learn how to control it. I asked a couple patients before, when I was putting this presentation together, what they thought would be important to share, and biofeedback was a big one. It had made a big impact for them. And then I think one of the other things, and probably the most important thing that we do in physical therapy, is education. Personally, I think that's our most important job, because you're with us maybe 1 or 2 hours a week, but the rest of your life, the rest of your week, 24/7, you're on your own, and you're living in your body. So it's important to learn how to care for yourself, what self-treatments that you can be doing, how to manage pain in the most effective way, what's normal, what needs work, and how to work on it. So hopefully, when you go to physical therapy, not only you're treated in that moment, but you leave physical therapy with a much better understanding of what's happening in your body. And that knowledge just by itself is so empowering. I think that for patients with chronic pain, and specifically with endometriosis, sometimes coming to physical therapy is the first time you've had a chance to sit for an hour and explain to someone what's happening in your body, and have that person touch with their hands and watch you move and say, yep, you know what, I see that, you're absolutely right, that's happening, and we can treat that. It might be the first time that you felt heard and truly understood, like in terms of what's happening. And we have the benefit of getting to spend more time with you and really getting to be hands-on. So sometimes that by itself is just the most important thing for someone to really come to an understanding of what's happening in the body and how it can be dealt with in the most effective manner, and what are reasonable goals that can be set. So then the last question would be, well, how do I find this magical physical therapy? There are pelvic PTs all over the place, and there's some really, really good ones. I think if you have endometriosis, you want a really, really good one, and you want someone that's experienced in dealing specifically with endo. Because there are pelvic PTs that maybe specialize in postpartum issues, or maybe specialize in bladder problems, and you really want someone that's very experienced in chronic pelvic pain or endometriosis. So I put together a list of a few directories, and the directories can be helpful. I'm going to read them out very quickly, and I think this is being recorded, so you can go back and look at it. One would be pelvicguru.com. Another is pelvicrehab.com, PTL Women's Health, APTA.org, pelvicpain.org, and I'm sure there's more. My favorite way to find a practitioner is really just Google, because you can put in your city, your area, and then you can really specify in your search terms what you're looking for. So the terms that you're going to start with would be pelvic health physical therapy, or pelvic floor physical therapy, or women's health physical therapy. And then you're going to get your list of people in your area, and I highly recommend you start calling and you ask to speak with a therapist. And I know that seems a little nosy and labor intensive, but it is definitely worth it to find the person that is truly the right fit for you. You want someone who's a pelvic health therapist, obviously. You want them experienced in pelvic health in general, but you also want someone specifically experienced in working with endometriosis, patients with endo, and with whom you resonate. Clearly, we're working really sensitive areas, very personal, one-on-one. You want it to be someone that you feel a connection to and that you feel confident in. You have to feel confident and comfortable when you're going into this. So don't hesitate to ask questions. We love it. We want to get to know you too, and we want you to be comfortable. So get your general list, whether it's through Google or the directory, and then start calling and connecting and find the person that's the best fit for you as an individual. So that's my chat. I hope that as a result of this discussion, you understand now what I mean when I say that PT doesn't treat endo, it treats the constellation of symptoms that results from endo. And I hope that there's a better understanding of how and why these symptoms arise. I'd like to open up for questions. I can figure out how to do that. And you can always contact me personally if you prefer.
Cool. Thank you so much, Leslie. So I did receive a couple of questions before the webinar. So one of the questions, and you just went over this, but they went ahead and asked, do I have to be referred by a doctor to get pelvic physical therapy for my endo?
That's a really good question. It depends on your state. Every state law is different. You're going to have to check in your state, call the office, the physical therapy office, and ask them what they need. Some states you can just walk right in. Other states you do need a referral. And usually if you want to use your insurance, many insurance companies will require that you have a referral, whether or not your state allows it or not. So you'll have to check depending on where you live and also what your insurance is.
Thank you. So another question we have from Julie is, I went to a pelvic PT who did visceral manipulation. She lightly touched my abdomen for the whole hour. It didn't seem to be helpful to relieve my pain. Is visceral manipulation an evidence-based technique?
That is a really good question. Visceral manipulation is super light body work, so it shouldn't be painful. It shouldn't feel really deep. And there are practitioners that train really hard for many years to do it well. So it's definitely something that requires a lot of training and a lot of skill, and there's an art and science to it. Visceral manipulation practitioners will tell you that it can take, let's say, a few weeks to feel results from their treatment. So it's probably not going to be the thing that gives you like that immediate, oh my God, I felt it change and release. It would be a component maybe of a lot of other things that would be happening in physical therapy. And as far as evidence-based, I think that's a brilliant question. Everything we do in PT, we try to be very evidence-based. And I believe there are some studies that utilize visceral manipulation as one of the components of their manual therapy protocols. But I would have to look into that a little bit deeper to see if there's anything specifically for visceral manipulation.
Thank you. So another question we have from Alan is, can physical therapy treatment be considered post a surgical attempt to correct my endo? Unfortunately, the problem still remains. How many sessions should I expect?
Okay. So the first question was post-surgical PT. Is that effective? And the second one was how many sessions?
Yes.
Okay. Physical therapy is amazing after surgery, and sometimes that's even the most effective way to utilize it, because theoretically surgery would remove the source of dysfunction, the source of disease, the source of all that chronic inflammation and pain and nervous system irritation, and then you go to physical therapy and you can release all these other issues, and they make a really wonderful combination when they're both done well. So yes, it's great for that. I definitely recommend it. Some surgeons like mandate you have to go to physical therapy after you have surgery. So that's definitely a good thing to try. And then as far as how many sessions, that is the first question that anyone asks me when they're calling to find out about PT. And unfortunately, that can't tell you that. It totally depends on your individual case. Everyone's history is different. Everyone's surgery is different. Everyone's response to pain is different. So when you go for your evaluation with your physical therapist, that's going to be one of the things you talk about in the first day. So they're going to do their eval. They're going to get your history. They're going to talk to you about their plan of care for you. They say, here are the issues that we need to work on. Here's how we're going to work on it. And this is how long it should take. But they won't be able to tell you that until you've actually gone for your evaluation. I can tell you that typically in my practice, we treat once a week, maybe twice a week. It's not like standard PT when they say go 3 times a week for 4 weeks and then you're done. It's a little bit more spaced out. And in my opinion, that's why doing a lot of self-care and homework is important. Because you get better results and faster results when you're able to do things yourself at home like every single day.
Thank you. And then one other question we have is, can I change my diet to assist in reducing inflammation?
Very cool question. It's like a pet project of mine. I think that's a really interesting thing to delve into and super personal. It's yes, the short answer is yes, you can. And then a little bit, I don't think that I'm qualified to discuss like all those things as a physical therapist rather than a nutritionist. I think the nutritionist who's experienced in these issues would be the best person to go to. But in general, we've all heard of things like ginger and turmeric and fresh food, avoiding processed foods, avoiding things like dairy and sugars and processed carbohydrates. All those things can absolutely have an impact. I've had patients who go on elimination diets and slowly add things back in, and they tell me, they found very specific foods or drinks or whatever they're doing that directly contribute to their pain. So that can be really important, but I think you should have guidance from someone who's experienced in that and can walk you through other stuff.
Thank you. So I think that might be the end of our Q&A session. But if there are any further questions, I'll make sure to let you know, Dr. Wakefield, just in case. But I want to go ahead and thank Dr. Leslie Wakefield for being part of our webinar today. We really appreciate the information you provided to us. And we will be having another upcoming monthly support group webinar for the month of July. So please keep an eye out for that. And I just want to go ahead and thank Dr. Wakefield again and everybody for watching. Thank you so much. Bye-bye.